This is Mark Grafton from C.O.R.E Physical Therapy and Sports Performance, and we're very happy to bring you a special video today on dry needling. The video will serve to answer a lot of questions that our patients ask us very commonly about the process of dry needling. It will answer the number one question is, does it hurt? Number two, how long does it take? And number three, what kind of results should I expect from a dry needling session? This video will answer that, give some history and some of the physiological foundation of why we dry needle and how it's actually different than acupuncture. It's important to know that trigger point dry needling has been around for a long time and has been done for decades by physical therapists. It actually dates back to the 50s and 60s when it was invented and conceptualized by Dr. Travell. That was a prominent cardiologist at the time that had a fascination with muscular pain and myopain. Her research serves as the backbone, the very foundation of most of our principles that we use today with dry needling trigger point style. And that is the style that we use here at C.O.R.E Physical Therapy. The typical dry needling session begins in a private treatment room for your privacy and your comfort. There are various different types of needles to be used depending on the body part we're working on and the size of the individual. A taut band can be found as a trigger point within a muscular unit very easily by a skilled clinician. It will often reproduce your pain or referred symptoms to other areas of the body, sometimes so pronounced that they will show up on an MRI or infrared technology. The trapezius is a very commonly activated trigger point from sitting for long periods of time or using a computer. You can see the referred pain patterns that are typical for that muscular system. This is a quick demonstration of the trapezius release of the trigger point dry needling technique. Careful attention is utilized to make sure that we go into a posterior to anterior and slightly superior position to the trapezius to stay away from any other vital structures. The pistoning action is vital to make sure that we get that local twitch response that will reset the muscular system and trigger point and allow it to relax. From another angle, you can see that she does not have any pain with this procedure. Other common areas of release and trigger points that are very common with normal individuals and athletes are the glute minimus. The glute minimus is very commonly mistaken for sciatic pain or sciatica, referring down the back of the leg. Also involved at times is the piriformis, which irritates the sciatic nerve and can refer pain to the buttock region, the hip, the SI joint, and back of the leg. And is a common culprit in the SI dysfunctional unit or rotation of the hip, and can cause lower back pain, buttock pain, back of the thigh pain, and even ankle pain at times. The next most common release technique for lower back pain is the Quadratus lumborum, which often refers pain to the buttock region, anterior and posterior hip. Once the patient is in the side-lying position, we can gain entry into the Quadratus lumborum. Careful and critical palpation skills and clinical expertise is vital for safe entry into the Quadratus lumborum. Careful pistoning action and localized twitch responses are critical for releasing the trigger point of the Quadratus lumborum, often reducing pain by up to 50% or more immediately. The Quadratus lumborum is an extremely deep and small muscle group that plays a vital role in back pain and referred pain down the leg, into the hip, and into the lower back and glute region. Because this muscular unit is so deep and so very small, it is almost impossible to release this in any other fashion. Self-myofascial release and even manual skills are very difficult to release this muscle group due to its size and deep location underneath the paraspinals. From this position, we can get to the psoas major, which is a hip flexor in the front of the spine that originates from the anterior portion of the spine, often radiating pain down the leg, into the front of the hip, the SI joint, and lateral hip, and is many times a culprit of the lumbar pain and instability, and even pelvic rotation. The final muscle that we will be demonstrating a trigger point release on is the gastroc, commonly overused and overexerted during running activities and sports, and is commonly needed to be needled due to its large nature and size to an athletic population. Now this is an actual patient here and not a demonstration purpose, so you can actually see the localized twitch response happen twice throughout this needling session. We hope you enjoyed this video, and we look forward to any questions or comments that you can leave in the comment section below. Thank you for watching.